Okay. Hello, everyone. Welcome to our August educational webinar. We're going to get the show on the road here. For those of you who know who weren't able to attend, we're going to be sending out a pre-recording of this same topic after. And if you have to leave early from this, you can always listen to that recording. We're grateful to have Danielle Laurie join us today, and we are grateful that you're joining us and taking time from your busy schedules. For those of you who don't know me, my name is Andrew McGill. I'm a wealth advisor here at 12 Points. And this month's topic, I know you got some reminder emails, but just so we're clear, it's Medicare. And we have Danielle, as I said, joining us. Danielle is a client educational specialist and program manager with BlackRock. And she works on the business consulting team. And she's an instrumental in providing strategic consulting, industry insights, and leadership development. As a national specialist, Danielle focuses on financial planning topics such as Social Security, Medicare, and college planning. So before I turn it over to Danielle, I just want to say some housekeeping things and just high level. We know Medicare can be very daunting for many folks. And our hope here is that we make it not that way, and we provide some education and make it fun. And if you have any questions, I'll be checking the question box here as we go, so feel free to ask questions. And if you want to talk about your situation after the fact, we've been more than happy to do so. I'm excited for what Danielle's put together here today, and I'll turn it over to you, Danielle. And thank you again for joining us.
Excellent. Thank you, Andrew, and thank you all for joining. So over the next 25 minutes or so, I'm going to be going over some of the basics of Medicare, because like Social Security, it does have several parts to it. I actually like to refer them both as the most complicated twin pillars of support for older Americans, because they do not make it easy. With Medicare specifically, there are deadlines, there's different enrollment periods, and I would say the worst part is that you risk financial penalties that could actually last the rest of your life. So the goal here isn't to be exhaustive, but rather help you understand some of the general ins and outs of the program, because it is very important as you approach age 55. Now, I hate to break it to you, but the reality is Medicare is very complex. And according to this study, the vast majority of individuals don't fully understand the rules. In fact, 75% of retirees that were surveyed, they truly believe that they have the knowledge to select the right Medicare plan. Yet, out of the same retirees that were surveyed, only 20% of them correctly identified the components of original Medicare. So the good news is, if you're on this call, you have access to some really great resources. You can work with Andrew and his team to help you find the right plan, and that is suitable for your needs, because you will quickly realize it can get very overwhelming very fast, and there are a lot of options to choose from, and it can certainly be difficult to navigate alone. So that's why we do encourage you to consult with Andrew or a Medicare specialist in your area. Make sure that you enroll in the right coverage, just to ensure that you are ready for retirement. So what is Medicare? Medicare is the federal health insurance program for those who are 65 or older and for those with disabilities. And it is made up of four main parts, which is Part A, Part B, C, and D. Part A is your hospital insurance, and Part B is your medical insurance. So these two parts, they make up what is often called your traditional or original Medicare program. So when you enroll in Medicare, you are automatically enrolled in original Medicare plan. Again, Part A and Part B, which is a fee-for-service plan, right, offered by the federal government, and it's available anywhere in the U.S. Now, if you don't want just the original plan, you'll need to make more choices and enroll in various options. Like, for example, Part D, which is your prescription drug coverage. Now, many people also purchase Medigap, which is just additional coverage, right? It's a supplemental coverage that is issued by private insurance companies. Now, the other option is Part C. This is Medicare Advantage, which is an all-in-one alternative to your original Medicare. These plans are also issued by private insurance companies, but they are approved by Medicare, and they typically do offer the combined benefits of Part A, B, and usually Part D, and sometimes some other benefits. Now, regardless of the plan that you do decide to go with, whether it's basic Medicare with a supplemental Medigap plan or Medicare Advantage, right? It's just a different route you can take. You'll need to sign up for traditional Medicare first through Social Security. So that's parts A and B. First step, you enroll in that through Social Security. Now, you're not eligible to enroll in a supplemental plan or the Medicare Advantage plan without doing that first. So that is important. That is the very first step you'll want to do. Now, if you're wondering, which plan is best for me? Like, which option should I go with? You will have to choose a plan that's best suited for your own needs, right? Everyone's needs are unique. But for example, if you have current healthcare needs that require, let's say, certain medications or certain physicians that you want to go to that you've been going to for the past 30 years, you may want to look into getting Medicare with a Medigap supplemental plan because they do allow you to have a more personalized plan. Medicare Advantage is more of a blanket overall coverage and it doesn't necessarily allow you to personalize your needs. A lot of times you need referrals for certain doctors and you have to go to certain ones. So I would say that whatever plan's best for you just depends on your needs and your preferences. But you do want to just make sure you're looking into all of the options because everyone's situation will be different and all of your needs will be different as well. Now, let's move on to Part A, hospital insurance and some of the costs. So in general, Part A covers things like hospital stays, skilled nursing facility, home health care, and hospice. Part A is premium free for most people, but specifically for those who have earned 40 credits through Social Security, or they're eligible through their spouse's work record. So you yourself may not have worked your whole life. That's okay. As long as you're married to someone who did contribute to Social Security, you can still get Part A free. Now, if you're not eligible for premium-free Part A, anyone could buy it, although it is very expensive. So, for example, the cost is around $505 a month for 2024. Again, a hefty price, but it is available if you're looking to purchase it. Now, many of you won't have to worry about the premiums, as I mentioned, but you do need to worry about the other out-of-pocket expenses. So there are deductibles and copays that you should be aware of. For the first 60 days, you have to pay a deductible of $1,632, as you can see on the screen. And for copays, the first 60 days of each benefit period, you don't have to pay anything. So again, for the first 60 days, you don't have to pay anything, but for days between 61 and 150, you do have those daily copays. So although people say Part A is free, because yes, the premium is free, as you can see, it could also come with a cost. So let's say you end up having to extend your stay in the hospital, something that maybe you didn't initially plan for. Those costs can really add up. So you want to make sure that you're structuring your retirement plan to absorb some of those additional costs. So now let's look at Part B, medical insurance. So it's important to note Part B covers about 80% of the cost of most services, which include doctor's visits, outpatient care, lab work, x-rays, preventative services, and assortment of other medical services as well. For this part of Medicare, you will have to pay a premium, and this premium is directly tied to the income that you generate in a particular year. Therefore, how you generate that income for retirement can actually directly impact the amount of premium you will have to pay for Part B. So this is where you'll want to discuss your options with your financial professional, a tax consultant, see if there's any strategies that could actually lessen your income, because there is this premium that you will have to pay. So for Part B, as I mentioned, it has an income-related monthly adjusted amount. It's called IRMA. You may have heard of it. That's essentially what they use to determine how much your benefit premium will be. So this is added to Part B and Part D premiums, and again, is based on your modified adjusted gross income. Now, one thing I do want to point out is that in order to determine this premium, they're actually looking at your most recent tax return. So the most recent tax return that's provided by the IRS is usually from 2 years prior. So that means that they're going to be using that tax return from 2 years ago, 2022, to determine your 2024 premium amount. Therefore, it's very important to know that if you have a life-changing event such as retirement or loss of income, or you're moving, you got married, whatever it may be, if you have a life-changing event, you can actually call Social Security and give them an estimate of what your 2024 income is. And they will actually use that estimate to determine your premium amount. So again, it's called a life-changing event form, SSA-44. You don't have to memorize it. You can simply Google it or reach out to us. We'll send it over. But that's how you can update your premium with Social Security to get an accurate estimate, because you don't want to be paying over what you should be currently. Now, the last thing with Part B is that many of you may be saying, I don't have health issues right now. I don't want to pay a premium. And you might want to hold off on applying for Part B, but you need to make sure that you understand that if you don't enroll when you're supposed to, which we will dive into the enrollment periods on the next slide, if you don't enroll when you're supposed to, you can incur a penalty. And that's a 10% per year penalty for each year that you delay. So let's say you delayed enrolling for 3 years when you were supposed to be enrolled. That could be a 30% surcharge to your premium. So again, the enrollment periods are super important. So how do you enroll in Medicare? If you are collecting your Social Security retirement benefits, enrollment is automatic. And actually, you'll receive a card in the mail 3 months before your birthday confirming your enrollment. Now, if you are not collecting Social Security benefits, you will have to proactively reach out to Medicare 3 months before your 65th birthday and apply. And once you apply, you are billed quarterly for those Part B premiums. If you're collecting Social Security, those premiums are automatically deducted from your Social Security check. But again, if you're not collecting, those premiums will be billed to you quarterly. Now, it's important to keep track of the enrollment periods, as I mentioned, because you'll have to sign up in one of the 3 enrollment periods, depending on your personal circumstances. So Part B has 3 main enrollment periods, as you can see on the screen. So the first is your initial enrollment period. This is a 7-month period, beginning the 3rd month before you reach age 65 and ends 3 months after your 65th birthday. The general enrollment period is for those who maybe missed their initial enrollment period or do not qualify for a special enrollment period. And the general enrollment period is January 1st through March 31st of each year. And lastly, the special enrollment period is for anyone who is beyond age 65 and covered by their group health plan provided by their employer, and they are still working. So that's really key when it comes to special enrollment period. It must be based on current work or your spouse's current work, right? So let's say your spouse is working and you have employer coverage through their employer plan, then you would also qualify for the special enrollment period, meaning you can hold off on enrolling in Medicare. And essentially, you have 8 months to enroll in Part B from the moment you stop working or your coverage ends, whichever comes first. So as long as you enroll within those 8 months, you will not receive a penalty. Now, you may also notice that you are bombarded by Medicare advertisements towards the end of the year. And this is because there is an open enrollment period, and it starts October 15th through December 7th. So this enrollment period, it's not on the screen that you see in front of you, but I do like to just mention it because this is for anyone who wants to switch from original Medicare to Part C or vice versa, that you want to change your plan or drop Part D, for example. That's your opportunity to do it. So each year during that time, it is a great idea to review your current plan and make any necessary changes because everyone's situation differs, right? And your situation may differ throughout the year as well. So you want to make sure you're reviewing your plan annually, and then you can make those changes during the open enrollment period. And if you do decide to make those changes, the coverage goes into effect of January 1st of that next year. Now, as I mentioned, if you are still working at age 65, you may not want to sign up for Medicare because there could be some costs associated, at least for Part B. So if you are covered by an employer plan or spouse's employer plan, Medicare would actually be secondary to your employer plan. So you may want to enroll in Part A, and we typically recommend that you do because it likely won't cost you anything, and it might just pick up some of those additional costs that are not covered by your employer plan. So Part A, it doesn't really hurt to apply. Just keep in mind that if you do sign up for Part A, you are no longer eligible to contribute to an HSA plan. So that's a health savings account. With Part A, they also have an automatic six-month look-back period. So in other words, you'll need to make sure you're not contributing to your HSA at least 6 months prior to you enrolling in Part A. And that way you avoid the penalties that would occur by the IRS. So again, Part A doesn't hurt. Typically it's free for most of you. It would just pick up some of those additional costs. Now, on the other hand, as we discussed, Part B does have that premium that's tied to it. So you may want to hold off on Part B if you are still working and you have coverage through your employer. It may not be worth it to pay for that additional premium. In most cases, the employer plan is better and covers more, but obviously everyone's situation, so look into that yourself. But most people do hold off on enrolling in Part B because it does have that premium tied to it. All right, let's look at Part D and some of the out-of-pocket expenses that you could expect to receive depending on the specific drugs that you take. So for Part D, you'll have your initial deductible, which as you can see in 2024 is $545. So Medicare pays for 75% until your drug cost exceeds $11,477. And after that, starting in 2024, Medicare will pick up the full cost of covered medicines. In addition, how much you pay for your Medicare Part D premium is also based on your income. So high income beneficiaries are actually charged an adjusted amount to their Part D premium as well. And usually the monthly plan premium is paid to the Part D plan, and the adjusted amount is then deducted from the person's Social Security benefit. So the premium for Part D, it is based on your 22 federal income tax return, right? They use two years prior, as we discussed. It's the same exact thing for Part B. And you'll just want to make sure that if you do have a life-changing event, you are submitting that form, SSA-44, just verifying the reduction in income, because clearly it does tie directly to these premiums for Part B and Part D. So when it comes to choosing the right Part D plan, there are a few things that you'll want to think about, because you do have a lot of choices, but when looking into your Part D plan, you'll essentially just need to decide like what is most important to you. So you'll see we categorized it into 3 parts. The first is cost, right? Is this most important to you? If so, you should really focus on premiums, deductibles, and copays. Plans that offer lower premiums are likely to have higher deductibles and copays, and vice versa. Some of you may use a lot of, let's say, high-cost drugs and may be better off paying a higher premium so that you can enjoy those lower deductibles and lower copays. So this is nothing new for all of you, but if you are someone who maybe doesn't use a lot of prescription drugs, maybe you're better off with lower premiums and higher deductibles and copays. So again, cost is just one bucket to consider. The next is coverage. Is this most important to you? So not all plans cover the same types of prescriptions. I would probably say this is very important. Let's say you have specific prescriptions that you know that you will need for the rest of your life. You want to make sure that those prescriptions are covered in whichever plan that you are choosing. Again, like these can add up. So if that is applicable to you, Medicare does have a really great formulary on their website. Essentially, you can just put in every prescription that you know that you will need, and then it will tell you exactly which plans cover that specific prescription. So coverage is just, again, another bucket to consider. And then third is convenience. So if you have a certain pharmacy that you've been going to, or you want the ability to order through the mail or have your prescriptions delivered to your doorstep, that is something else you'll want to ask when looking for these Part D plans. So clearly there's a lot to think about, and each and every one of you will have different needs. So I do suggest that you kind of figure out what is most important to you, and then look for a plan that hits those highest priorities first.
And Danielle, we just have a quick question in here. What form is needed when there's a life-changing event? Do you know the name of that form?
Yes, it's called the life-changing event form, but it's SSA-44. So if you were to Google SSA-44, it should pop up. But if you have any issues, you can reach out. We'll send it over.
Perfect. Hopefully that helps, Marcia.
Yeah. Thank you for the question. All right. So moving on to Medigap. As I mentioned, there could be a lot of out-of-pocket expenses associated with Medicare. So I would say many people consider a Medigap or supplemental insurance plan, so just another term. These type of supplemental plans are issued by private insurance companies, and they provide reimbursement for the out-of-pocket medical expenses such as deductibles and coinsurance. So this is in addition to the Medicare plan that we discussed, and there are a few things that you'll want to know about Medigap policies. So the 4 things I like to mention is generally you must be enrolled in Part A, B to buy a Medigap policy, as I mentioned earlier. And this policy covers one person. It's not a family plan. It covers one person. Medigap policies should also be purchased during the first 6 months of being enrolled in Part B. So during these first 6 months, that window, you are guaranteed the right to buy a Medigap policy. This period cannot be delayed or replaced. And after this period coverage, so let's say you enroll after those first 6 months, the plans are not guaranteed. And they actually could use your health against you. They can get the prices up there. So you want to make sure if you are enrolling in a Medigap policy, that supplemental plan, you're enrolling within the first 6 months of being enrolled in Part B. I would say it's super important. The third thing I like to mention is that the costs vary based on coverage and insurer. And fourth, these policies cannot be used in conjunction with Medicare Advantage. So it's one or the other. So again, it's traditional Medicare Parts A and B with a supplemental Medigap plan, or the other direction is getting Medicare Advantage, which is a blanket all over coverage. So 2 different options and routes that you can take. That's the way I like to look at it. And when it comes to Medigap, there are really 6 key gaps that you'll need to consider. So those are deductibles for Part A, the cost of extended hospitalization, so they're all listed on the screen, coinsurance on doctor services, outpatient care under Part B, costs of, let's say, foreign travel emergencies. So if you're someone who does travel a lot, you want to make sure that the supplemental plan covers the foreign travel emergency. Even nursing home costs. So these are some of the key gaps that you'll want to consider when choosing the Medicare supplemental plan. And they would essentially just help pay with some of these out-of-pocket expenses that your original Medicare does not cover. Now, again, as I mentioned several times, these are issued by private insurance companies, so the cost can vary widely. It's a lot like buying a car.
Danielle, sorry to interrupt here. We just had one quick question. The link to use to find the meds, to see the meds, do you recommend the cms.gov? Yes,
that's the website.
Okay,
yep.
Perfect.
And they have a formulary on there. Again, I can help send the link if you can't find it, but that's the website that you should be using.
Okay, Marcia, I will send that to you offline. Thank you very much.
No problem. So when it comes to Medigap, the cost can vary drastically. So I always like to bring up the example of the very fun experience of buying a car. So the cost for the same car could vary drastically by dealership and by state. So being from New Jersey, when I had a shop for my car, I got a completely different price just by calling a dealership in North Jersey versus South Jersey. So it's the same exact thing for Medigap, right? You'll want to look at the premiums compared to the coverage from several different plans and see which one at the end of the day makes the most sense and gives you the most for what you're paying. So in this example, you'll see that we have a 65-year-old female who's looking to sign up for Plan G, which is the most comprehensive plan that they offer. So Plan G, you'll see that the cost was $800 roughly for one plan, and the other plan is around $6,000. So this is a huge range. Again, I can't emphasize it enough. Make sure you're doing research, you're shopping around, and ultimately decide what's best for you.
And Danielle,
right, so now that,
one other question here was, Medigap cannot be used with what?
It cannot be used with Medicare Advantage. So they're two separate options. So you can either do traditional Medicare Parts A and B, and then you add on a supplemental Medigap plan. That's one option. Or the other option is enrolling in a Medicare Advantage plan, which is also issued by private insurance companies, but it's just a different option. So it's you can't enroll in both a supplemental Medigap plan and a Medicare Advantage plan. It's one or the other.
Thank you very much.
You're welcome. So now that you understand some of the basics, the next steps would be to, again, do your research. I suggest giving yourself at least 6 months of looking into these plans. And the best way about finding that information is to visit medicare.gov or just Google SHIP, so SHIP Medicare, and insert your state. Because like I mentioned, we just discussed Medigap and Medicare Advantage. They are issued by private insurance companies, and it varies. So you want to make sure you're looking into all of your options. This is really your chance to leverage Andrew and his team and the Medicare resources that are available. 4 main resources that I like to mention. One is Health Pilot. It's a company that we've partnered with. It's available for you to essentially look up different plans. It makes it very easy for you to compare your options and find the best plan for you. So again, that's Health Pilot. Then there's Health Insurance Specialists. So there's state-specific certified Medicare advisors that you can look up that are in your area. And then there's volunteer state agencies as well. These are typically free offerings. There's SHIP counselors. So that's where you'll want to Google SHIP Medicare, insert your state to find a volunteer state agent next, like in your area as well. And then just a general Medicare website, medicare.gov, cms.gov as well, or you can call the 1-800 Medicare number or visit a local Social Security office if you have like general questions. I wouldn't leverage them to help you pick the best plan. So with that, I know that was a lot of information. We've reached about 25 minutes. So at this point, I'd like to open up to any questions that you may have. And again, just put it in the chat if you have any questions for me.
So we have one here. So the Marcia, it would be Health Pilot. And Danielle, could you just say one more time what that website is?
Yes, so it's a value partner with BlackRock. They are a company that essentially they figured out a way to make this process a lot easier. So essentially you can go right on their website, you can search different plans, you can easily compare the plans side by side. You can let them know like what you're interested in. You can have a one-on-one consultation. So they're just a resource out there it's a free cost for you. It's just another resource that you can leverage if you're looking to find the best plan and you need some help with that process. Health Pilot is available, and we can also send over the link to their website as well.
Okay, perfect. Thank you. Let's see. All right. Marcia, we would be more than happy. We can set up time after this to speak to your situation. Absolutely. And Marcia had a question. Couldn't hear all the options that were discussed. So, Marcia, we can reach out and talk through all of these in detail coming out of this webinar. And I will put I'm going to put in here the website to Health Pilot right here in the questions.
Yeah, and I can share the 4 key resources that I mentioned. I can share that with you as well, Andrew, so you can forward it along.
Perfect. All right. And I will wait. We'll just see if there's any other questions here. All right, healthpilot.com/advisor is right there in the questions.
So that link may be for you, Andrew, if it's /advisor, we can direct them right to the website if the client's looking to go to that website themselves. If they're looking to go on that website with you side by side in a meeting, then you can use that link.
Okay, perfect. Okay, so they'll go to right to healthpilot.com.
Correct. Yep.
All right. Perfect. Thank you very much.
No problem.
Okay, we have, I don't know if you can see the chat here. All right. Thank you, Jeff. Edward has, I've heard that there are early retirement options at 62. If person is about to retire at 62, are there any medical insurance options for early retirees?
So in regards to Medicare, no, unless you are disabled. So Medicare is for those who are 65, or if you are disabled, then you could be eligible for Medicare. Otherwise, no, they don't offer it any sooner. You may be, 62 is typically the age for Social Security benefits. So that's the earliest age you could file. Social Security is completely different in terms of the rules, and Medicare is like health insurance. Social Security is a benefit you're eligible for. So I'm not sure if that's kind of where the confusion may be, but in regards to Medicare, age 65 is the earliest you can enroll, or again, if you're disabled, you can get it earlier.
Okay, and then they look at their local health connector prior to that if they're not disabled, or whatever
Right.
they're, okay.
Yeah,
perfect.
like you would just have to get like private insurance companies.
Yeah. All right, we have another question here. Is there a site for individual states that show available plans?
So if you go to the Medicare.gov website, you can put in your zip code, and they will essentially show you what your options are. There's a lot of different like private insurance companies that will be in your area that you can, if you just Google your state, you can find options that are available to you as well. But I would start with the Medicare.gov, or the other website is shipacenter.org, and then you put your state in there, and a drop-down menu will occur. So I'll send those links to you guys as well.
Perfect. Okay, we have one other one. In order to qualify for Medicare before 65, do you have to be on Social Security disability, or will long-term disability make you eligible?
You do have to be enrolled in Social Security disability. And once you are enrolled in Social Security disability, you would be Medicare eligible after 2 years. I would say most long-term disability plans, they require you to enroll in Social Security disability benefits. So you'll want to make sure you're asking them if that's a requirement. But if you are eligible for Social Security disability benefits, it's actually okay, because your benefit's not age reduced. You would actually receive your full retirement age benefit in full without receiving a reduction. So it's as if let's say your full retirement age is 67, you're going to receive that full amount much sooner if you are disabled. So it really doesn't hurt to enroll in Social Security disability, but you do need to be enrolled in Social Security disability to be Medicare eligible.
Great, thank you very much. Let's see if there's any other questions. Okay, we have a question here. The income-based payment for plans, would they be individual or combined with my husband? And could I get a screenshot of the slide that shows the incomes and payments?
Yeah, so if you're married filing jointly, they will look at your combined income, and yes, we'll send you the chart. We have a Medicare quick reference guide that's really great as well. So we'll send that along. That does list the thresholds.
Perfect. And we will be able to, we'll have the pre-recording, but can we send out these slides, Danielle?
Yes, you can absolutely send the slides.
Okay, perfect. One other question here: if you are in generally good health, which is better, Medigap or Medicare Advantage?
So it really depends on your particular needs, right? So if you do want to have more flexibility in doctors, that would be a Medigap supplemental plan would probably be the better option for you. So I guess if you're in good health and you don't really go to a lot of doctors, we could assume that maybe you don't want that flexibility, and therefore the Medicare Advantage may be the best option for you. So I would say Medicare Advantage to answer your question, but again, look into your options. It's more so deciding, like, do you want that flexibility to go to certain doctors, or are you okay with going to the preferred list that they have? Medicare Advantage also usually gives you some dental coverage and vision in some cases. It varies, but it does typically give you some additional benefits as well. So that may be the best route in your situation.
Okay. Let's see. All right, no additional questions right now.
Well, great. If anything else comes up, you can always email them over to our team. We're more than happy to address it via email as well.
Perfect. Let's just take 30 more seconds and let people go. All right. All right, we have, okay. If your spouse is on Social Security disability, when does she file for retirement?
Well, Social Security disability is it's equivalent to Social Security benefits and their primary insurance amount. So when you say retirement, I'm assuming you're saying Social Security retirement benefits. So in that case, they're actually already receiving that. So Social Security disability benefits will continue until as long as they are considered disabled. And then once they reach their full retirement age, the type of benefit changes to a retirement benefit. So that may be at age 67, but the amount remains the same. So nothing really changes for you. It's just on the back end, the type of benefit changes when it comes to Social Security disability to retirement benefits.
Okay.
Again, that's different than Medicare, as that is the topic for today, but they do go hand in hand. So just know with Social Security disability benefits, again, once you're collecting for 2 years, then you're eligible for Medicare.
Perfect. One of the questions that just popped up here, can you change from Medicare Advantage to Medigap coverage from year to year if needs change? I had understood if you go to one, you can't go back.
No, you can during the open enrollment period,
Okay.
October through December. Mm-hmm.
Thank you very much. All right. Well, I put in my email address here right in the answers for those who want to reach out with any other questions you have. Danielle, thank you very much for taking the time here and sharing all this information. And thank you all for being here. And we hope to see you next month for our September webinar. With that, have a great rest of your day, everyone, and enjoy your Labor Day. Bye now.
Take care.